Hey everyone, Ali here from HR for Health, and we are now doing part 3 of this series on how HR has gone wrong and some real life scenarios and nightmare stories that my good friend Greg is here to tell us about based on his experience. If for those of you who don't know Greg Essenmacher, he is the leading expert in fixed full arch dentistry. He helps transform practices that may or may not have implant practices into full arch powerhouses. And don't take my word for it. Talk to the hundreds and hundreds and hundreds of clients of ours and many groups and DSOs that use him. And so we are excited to have you back, Greg, for this part 3. Welcome.
Thanks so much. I've been enjoying the conversations. I hope they've listened to 1 and 2. If not, go back, rewind. It's okay. You can listen to 3 though, and then go back and listen to 1 and 2. No worries.
Yeah, exactly. Yeah, you got to do a good part with part 3, so they want to go back and listen to part 1 and 2.
No pressure.
All right, no, you've been awesome. You've been awesome. So let's talk a little bit about employee complaints. Now, when most practices, especially small to larger groups, are always worried about, patient complaints and, what's going to happen on social media and what kind of reviews am I going to get and so on and so forth. But employee complaints are even more crucial because there's so many legal potential problems that can come from it. And we in our law practice, but also at HR for Health, see a ton of stuff, having to do with, formal administrative hearings through the state, through, private letters sent, the demand letters sent by lawyers who represent the employees, class action lawsuits. I mean, there's just a lot of different kinds of potential problems that one can run into with regard to employee complaints. And so today's topic is, how do we deal with these kinds of complaints? And what are some of the common complaints that we're getting? And what I want to mention first and foremost is that whether it's a patient complaint or an employee complaint or your kids complaining or your spouse complaining, none of us like to deal with it, right? None of us like to deal with it. It's not positive information. It's very negative. And so sometimes we, hide our head in the sand because we're like, especially with employees, because it's like, okay, I'll just deal with this later. But that makes the employee feel unheard. And that's when we start to see problems, right? We start to see problems because if they're being unheard at the office, who will hear them, Greg? Guess who's going to hear them?
A lawyer, their patients.
Exactly. A lawyer is going to hear them. And you hit it on the head, and this is the part that I want you to, expand on. The patients.
Yes.
Yes, the patients. I mean, can you imagine if one of your team members is bitching and moaning to a patient just either through verbal cues
Or
or
nonverbal,
nonverbal
their
cues?
body language. Yeah.
Yeah. Greg, could that impact them signing off on a full arch, implant procedure, treatment
And I
plan?
talk about this all the time, case acceptance, right? So it's case acceptance is all about the patient experience, and the team development, the team influences that not only with the words, but their tone and their body language. That's why with clients, we have them record themselves presenting cases, and we listen to the phone recordings for those with lead calls. It has everything to do with that. And that's why our own behavior as owner and founders and how we're treating our team, that trickle down effect, it affects everything with our team, and it affects performance all the way around. So much so. Absolutely.
Yeah, exactly. And again, like we talked about in part 2, and those of you who didn't listen to part 2, go back and listen to that because we talk about how all the little things that happen in an interaction can impact case acceptance amongst other things. And so I think it's really, really important to talk about these things. So Greg, tell us, I know you got some amazing stories around this. Let's pick one story that comes to mind of an employer issue that impacted either case acceptance or I mean, it could be anything. It could lead to lawsuits, anything, that comes to mind on this topic. Let's start diving into that.
Yeah, when you look at clients, and there's one client in particular that I think of, and in the environment that we're in, or at least have been in over the last few years, it seems like the whole expansion and more was really what it was all about. And it was, how many practices do you have? And when I first met this particular client, this is going back a good 6-7 years ago, and it was expanding to how many practices they could get to. And when I first met them, they were up to 6-7 practices. And when you start to get to that critical mass, right? It's talked about by those that do mergers and acquisitions, and others that have a lot more experience in that space, right? Because we focus at G&A Consult on the full arch. And they talk about, at that level, you really need to start adding in, right, some of the senior level manager, some of the C-suite, things of that nature. At that point when I met, there was a lot of issues going on with, employee. There was probably 2 or 3 lawsuits that were going on that potentially could have turned into class action, because the pressures and the stress of, were people getting the right breaks? Were they getting the right amount of time off? There was just so much disgruntled actions that were happening. And I literally looked across the table and said to the pro at a desk and said, what do you want to be when you grow up? And it's my way, because I'm kind of a casual kind of guy and I like to have a little bit of humor. And they expressed that they really wanted to be like a full arch surgery center. And I said, then why do you have these 2 practices that are losing money, causing all this stress, and you can't multiply yourself? Why don't you focus on what you're really good at and clean up all this other mess? Because there really wasn't this, there wasn't a partner like HR for Health. There wasn't like an employee manual, or at least one that was being followed. And everything was just in disarray. And I think that's what happens so often with clients, because when we start working together, it's one of the very first things we ask is, let's see your employee manual. How are you actually implementing? Is it a living, breathing, or is it just something that sits up on the shelf and they sign off, right? A new employee on the very first day. Have you read through it? It's probably 20 to 50 pages long. Nobody ever looks at it again. And everybody has questions about, how do I ask for time off? What are paid holidays? And nobody knows, right? Now, I'm not going to say nobody. I shouldn't be so altruistic on, right? Most people don't understand it. And it's whatever somebody who's in the next operatory told them, or they heard as they were going to lunch together. It's just kind of like word of mouth and not something that's specific. And that can be super problematic for our clients, because what happens is then the owner founder gets caught off guard. And that is probably the worst thing that can happen, is you getting caught off guard. And at that point with that particular client, they did move into a different situation where they reduced the number of locations, started working towards becoming a full arch clinic. But what they didn't do is they didn't change their mind. They didn't change their mindset, and they didn't really get things formalized. And you hear the same patterns happening, just not on that scale, right? Things like, well, in full arch, you really need to be able to capture the leads that come in, right? And speed to lead is everything, Ali. So being able to handle the leads coming in on the weekends, critically important, especially if you're doing any type of media like television, right? If you play an ad on television or an infomercial on television, your calls are going to spike. So you want someone, or a call center, someone answering those calls. So when the question came up, how are you handling those? The answer of, we have employees do it on a volunteer basis and I'm okay paying them. That's not the right answer.
No.
It literally reminded me of the answer before, which was, there's no consistency. There's no policy. There's no, how do you have people sign up for that? How are you having them? Is it in place? Are they getting paid differently? Are they getting paid overtime? Are you still being HIPAA compliant when it comes to where those phones are being transferred to? Where are they answering the phones? On a cell phone? In their homes? How are they jettisoning in? How are they actually booking into the practice management system? There's so many pieces that having some guidance from a company that actually understands not just HR, because y'all aren't just HR, right? You can handle a lot of these compliance issues across the board. And that's why the partnership that we have at G&A Consult is so critically important, partnering with you all.
Well, and this is, I think, what makes your relationship with these doctors so successful. I know you never talk about yourself, so I'm going to brag about you a little bit, but I think the thing that really separates you, Greg, is that you're not just about the procedure, the technology, or whatever it is. You have a very human approach to the whole solution, which is what this is all about. We're in a service industry, right? We're in a service industry, and you have to have this entire system really working seamlessly together, which requires the people, the humans, to work seamlessly together. And that doesn't mean everyone's got to love each other and hold hands and sing kumbaya, but they've got to respect what is happening in the office. They've got to respect that they are being treated fairly. And you hit it on the head. The doctor who says, I just have team members volunteer, is basically saying, I can't be bothered to figure this out. So you guys figure it out. And the reality is that the team is not going to want to figure it out. They're not getting that six, seven, 10, $20,000 case. That money is not coming to them, right? And so they don't see that advantage, right, to necessarily volunteer or whatnot, especially if there's not like a compensation thing set up where they're getting paid per successful call or per booking or per consult or whatever metric you use. I'm with you 100%. I think sometimes we forget that to get the best and the most out of our team, we also need to make sure that they are well taken care of on many different levels. And this is one of them, right? How do you pay them on the weekends? How do you make sure they take phone calls? So
Well, and even if they are, and we work on team development and compensation and the KPIs, the key performance indicators with our clients at G&A Consult, even if they are being compensated in some way, shape, or form for conversion of that lead when they show up for a consultation, or the pass-through when they actually convert into moving forward with their treatment plan. Even if so, one thing I love, Phil Jackson, 11 Rings, you can't argue with it. His book 11 Rings, and he talks about leadership in that. And one of the points that you made just reminded me of one of the points that I always pull out in his leadership. He talks about empowering people. And he talks about being able to delegate, right? And empowering people of different touch points. And he did it with individuals, whether it was with the Chicago Bulls. And yes, they couldn't beat my bad boy Pistons in 89 and 90. Eventually they did, even for the three-peat. And then Michael Jordan thought he could play baseball and then three-peated again. And then
right.
he went to the Lakers and did it, but he got individuals to be in a system, right? And that was important. So he talks about empowering team members, but it doesn't mean that you cede your overall authority. And that's what's critically important. And you pointed it out there, right? Somebody who just says, oh, well, people will volunteer and I'll pay them for it. That's ceding your authority. That's not what we're talking about. It's really about empowering people and having somebody, because if everybody's responsible, nobody's responsible. And so it's
Exactly.
empowering an individual and giving them opportunity to be able to lead and grow within the practice. But that, in a structured way, helps them, and you'll know. And it doesn't mean that it's got to be somebody who's really good at sales or really good at converting lead calls. It could be somebody that's really good at leading with empathy in your practice. And that person is more than likely nowhere near the person that's driving conversion of leads or selling treatment plans. And this person can be empowered during your daily huddle or with your team to be able to lead that piece. So empowering individuals so that they feel a part of that team and want to do more. And for all of you that struggle and are listening with, I can't find good people, oh, people are leaving for, why is it that some practices and groups don't struggle with that? Because they have that empowerment and people want to give more and want to feel a part of a culture and environment. Not everybody, but a lot of people do. And it's
They
why
do.
they stay with and stick with. And that's a part of that compensation structure, and having a partner that can say, this is what you can do. This is how you can compensate. This is how you can have a comprehensive, living, breathing employee manual, instead of it being a document you slap down, they sign once, and have no idea from that point forward of any of the pieces of what it actually means moving forward. so they feel good about where they can get the information themselves. And it's really such an important piece because that's how employees become a part of your practice without having to give them equity, without having to give them more money, because money can't buy you love, right? It's not about like Billy Idol's more, more, more. How do you like it? And I could go back to the disco days too, but I'm not going to do that today, right? It's all about how do you actually empower them without ceding your authority, and having the right partner to do that is so critically important.
It is, and I'll say there's a couple of things you can do to start going down this road, and this is more of the technical side. You still need to hire Greg and his team to coach you on how to do this properly from a human touch perspective. But from a legal perspective, it's really important to have your job descriptions very well written and detail for the team so that they know exactly what they're doing and what they're working on, and what they should be focusing on a day-to-day basis. So that's definitely the first thing. The second thing is what we call micro reviews, which is you want to, as Ronald Reagan said about the Russians, it's trust but verify, right? Which means you want to trust that things are being done, but you want to make sure you're verifying it, through systems that are in place, or systems that Greg's team will put in place for you to verify that the tasks are being done. And if they're not being done, then what you do is you do these micro reviews where you talk to them, you say, hey, this is what I noticed. Let's work on improving this, and this. And now you could put it into a legal document or like a review on HR for Health, or you could keep it a little bit less formal and see if it improves. If it doesn't improve, then you maybe do it more formally. But one of the things that's a pet peeve of mine is waiting 6 months, waiting a year before having a meeting with the team about things that are not going great, right? These micro reviews are super important. And they could just be over coffee. It could be, hey, let's just take a walk. It could be anything where you're just having these quick conversations about here are the things I see, here are the things I want you to work on. And maybe you don't have it with everybody because some team members are doing great. But I think for a lot of people, if they're not, this is definitely something to think about. And once you do that, I think a lot of different things will fall into place. And by having the job description, having a tool like HR for Health to help you manage it and hold people accountable, and then have the real life training that Greg and his team, will can provide, especially if you're doing, full arch dentistry, then you're way ahead of the game, right? Way ahead of the game. So Greg, as we end today, what are some parting words you want to give to our audience? They've hopefully listened to all three parts of this seminar series, with examples of things that have gone right and sometimes things that have not gone right. But what would you say? What are some parting words?
Yeah, and I love that you brought up the job descriptions, right? Because when you're looking at job descriptions, so often it's done in the reverse order. It's here's a list of tasks and duties. Let's find a human to be able to stick into it. And one
Yep.
of the things at GNA Consult that we do is we talk with employees and find where their passion is, and find where there's coachable and teachable and where they really want to be a part of the team, and then be
Yep.
able to create those job descriptions that match
Yep.
and see where there is alignment. And that's the right person, right seat. And there's a model, and everybody probably has heard of it before, but we bastardize it a little bit and make it customizable to clients we work with. And that's so important. And you also pointed out another one, right? That 90-day action plan for each individual within. And the employees bring forward the three things that they want to work on, right? To move forward, to be able to get better, to improve if they want to continue to move forward and grow,
Yep.
because people don't want to feel stagnant, right? It's like pushing a boulder up a hill. There's no such thing as staying the same. You're either that boulder's either falling back over you, or you're slowly pushing the boulder up the hill and growing. And so my closing and parting words, and thanks for helping me to frame that and talk about, what would I say as parting words? There's no easy solutions. Like the time commitment that it takes to be a successful business owner can be overwhelming.
Yeah.
Finding individuals and trusted partners that you can lean on in order to make the investments will help you to bend time in order to get ahead of the game, to see a few steps ahead, and people that you trust that can watch your back. And that's really what it looks like. And so for those clients that we work with currently and those that are considering it, if you're doing full arch and you're thinking, I could be doing more, but I don't know where to go to, I don't have all your answers. G&A Consult doesn't have all your answers, but what we do have are best practices from clients we work with all around the country, from those that are just implementing full arch to those that are doing 40, 50 arches a month in parts of a big group and in individual just implant centers. If you're interested in learning more about that, about the training and coaching side or the operation side, because we do both, reach out and let's have a conversation. But the other piece that I'll say is everybody believes that their operations are in order. Take a good look. When's the last time, there's two questions I'll ask. When's the last time you've listened to one of your phone calls of a prospective patient calling into your practice? If it's been more than 60 days, you might want to change that. It's easy to do. The other piece that I'll say is, when's the last time that you've actually sat in on a performance review of any of your employees? If you can't answer that, or it's been more than 3 months, if it's been more than 6 months, if it's been more than 9 months, you might want to consider changing that. Again, I know you're super busy, but making an investment in your people is going to pay off so much more than making an investment in a piece of equipment. And that would be my parting words today.
Yeah, I think those are some really, really wise words. And for those of you who don't know, we are working hard to get Greg to come speak at our dental leadership summit that we're going to be hosting in Salt Lake City in October. So if you haven't signed up, I would highly urge you to do so. We have great speakers. Greg's going to be one of them. If his schedule allows, and others as well. And we're excited to put this on because, as you can see, leadership, team training, psychology is all over dentistry, whether you're selling full arch cases or you're doing a simple, filling on a patient. It's all part of the overall kind of communication that we want to have in an office to be safe, to be compliant, to not get sued, to be able to grow the practices, and to be in a place where you can really thrive, knowing that you're given the best to the patients, not just clinically, but also from just an experience perspective. So thank you, Greg, for all that you do. Please, if anyone has any questions, please go to his website. You can also book a strategy call with him by taking a picture of this QR code that's on the screen. If anybody wants information about HR for Health, you can also learn more about us by taking a picture of this QR code, and one of our team members will follow up with you and do an assessment of your current HR practices to determine if there's any holes in that and how we can help fix those. All right, everyone. Thank you. Hope you've enjoyed this 3-part series, and we hope to see you soon. Take care. Bye.